Good job. Okay. Hi, Mrs. Monglik. My name is Athira Nambiar, and I'm going to be your student physical therapist today. So basically what we're going to do today is I'm just going to ask you some questions, see why you're in, and just overall get a general feeling. So how are you?
I'm okay.
It's good. What brings you in today?
Actually, I have this hip pain, side hip pain,
Okay.
that it mostly wakes me up in the morning, like around 4 5, and then I can't go back to sleep. So I have lower back pain too, but it doesn't bother me that much because the hip pain kind of wakes me up in the night.
Okay. Is it specifically on one side or is it on both sides?
I think it is on both sides, but most of the time I feel it on my right side.
Mostly on the right. And so do you think that like some of the lower back pain is contributing to the hip pain?
I think so, yeah.
And it mainly wakes you up in the morning at 4 or 5?
Yeah.
How long does it last?
I think at least half an hour, 45 minutes. I remember that I can't go back to sleep and it's hard for me to go back to sleep.
Okay. Is there anything that you do at that time to make it go away?
No, I just toss and turn and try to get comfortable. If I remember, I apply icy hot, which kind of helps in that area.
And icy hot helps. Okay. Is there any like other time during the day where the hip pain is aggravated?
It's there, it's constantly there, but I don't think that it bothers me so much. I'm just used to of it now.
Okay. That constant pain that's there, what would you rate it on from like a scale from 0 to 10?
It does 6, 5, 6, 7.
Okay. And the pain that wakes you up?
Oh, that's like 9, 10. I can't hear it. Sometimes it's like needle pointing and
The needle pointing in the morning? But then throughout the day, it's just dull, constant, and it's mainly just like right here where you've been pointing.
Here, right here on the side.
Okay. And do you take anything for the pain in the day?
No, unless I have like a headache also with that, then I may take Advil, but that's like only once a month. I try to avoid that.
Okay. So does this like cause any like tiredness during the day? Are you more tired than you usually would say so?
I think that it's the inflammation, so I'm sure it's bothering me somewhere else also. Yeah, it may create fatigue. But once I start walking, I feel better. So I don't know.
When you start walking, it feels better.
Yeah.
So are you experiencing any weakness?
No.
Are you like sweating more?
No.
So obviously you have night pain because you wake up during the night. Is there any other pain?
No, not anything other than my lower back.
Have you experienced any weight gain or weight loss in the past couple of months?
No, it's same.
Okay. And you'd say you're overall like oriented very well. You're not confused about anything. Okay. Let's talk about your past medical history. Have you had any surgeries in the past?
Yeah, I just had one year back, my hysterectomy.
Okay. So when was that? Just a month and a year.
December of 2019.
Okay. And no other surgeries?
No.
Are you allergic to anything?
No.
Okay. Do you have any other like medical conditions that like you've been diagnosed with?
No.
No high blood pressure?
No.
No diabetes? Okay. Are you currently like taking, or do you drink?
Yeah.
How often?
Twice in a month, like half drink.
Okay. Do you use any other drugs? Do you smoke?
No.
Marijuana?
No.
Okay. And is there anything in your like family medical history that's important? Would you say?
Yeah, my both parents are diabetic and my dad is a heart patient and my mom has high blood pressure.
Okay. And has anyone in your family ever died from like a stroke?
No.
So let's go back to this hip pain. How would you say it's like affecting your daily life?
I think that inflammation does bother me. One way it is helping me positive is that I feel like I should walk so it will go away.
So walking really does make it go away.
Yeah.
once it's like completely gone, how long does it take to come back usually after you've stopped walking?
In 1 or 2 days, if I don't do any exercise and not walk, it comes back. Also, I think in cold it comes back. If it's very cold.
If it's
Like
cold,
maybe arthritis a little bit.
okay. And so when you're sitting at like a computer desk or anything like that, like at work,
Yeah, I don't like that anymore. I can't sit more than 1.5 hours because my lower back hurts a lot. So I have to walk and get up and walk.
so you're not able to sit for more than 1 or 2 hours.
Yeah.
Okay. And when you exercise, everything is fine. There's no pain. You're able to walk long distances.
Yeah, I mean, I do 3 to 4 miles easy. If I do 6 miles, the next day I'm kind of done. Don't do anything else.
So how often would you say you exercise in a week?
I think I walk at least 4 times a week.
4 times a week?
Yeah, if weather is good, maybe 5.
Okay. You mentioned arthritis earlier. Have you been diagnosed with that, or is it just a suspicion
So
that you
I
have?
did go to doctors like a couple of years back, and they did an X-ray, and they said that I may have little bit arthritis in my lower back and hip, but I'm not sure.
Okay. Have you ever had any other tests done? Like you just said, the X-ray. Have you done like an MRI? Anything
No.
else that the doctors wanted to
No.
do? Okay. Sorry. Is there anything else that you would like to tell me about your pain?
No, I think if I lose weight and gain some core strength, then the pain may go away, but that's just my theory. I don't know.
Okay. Yeah, and of course, like we can work on that. And is that what you kind of want to get out of physical therapy?
Yeah.
So mainly just working on your core and just gaining that strength as well as strengthen the hip
Yeah,
to make
unless
that pain
you
go away.
find that there are other reasons that you want to fix those.
And so you're definitely willing to do physical therapy. You've done
Yes.
physical therapy
Yeah.
before.
Yes.
Okay.
I mean, 4 or 5 years back, they sent me for physical therapy for IT band. So that really helped. I do like it.
So your IT band was
Tight.
tight. And would you say it's still tight, or did physical therapy help it?
Physical therapy helped. It would help more if I do those stretches and exercises more often.
So we would still say it's tight.
Yeah, a little bit.
And you just need more motivations to do
Yeah.
the
Yeah.
exercises constantly.
Yeah.
Okay, that's good. Have you been to physical therapy for anything else?
No, nothing other than my IT band.
Nothing other than that? Okay. Is there anything else you'd like to share?
No, I just need some kind of plan and some kind of motivation to just follow it.
Yeah, of course. So what we're gonna do next is, well, what we would typically do next is, I would just like test the strength and your range of motion in your hip and see if we could like reproduce the pain or make it go away. But we're not gonna do that today. So thank you.
You're welcome.